You're probably using your EHR exactly the way it came out of the box. Default templates, default dashboards, default everything. And your employer set it up that way because the default settings were built for a health center billing department, not for a 20-patient primary care day. Every extra click, every extra tab you scroll through during a visit, every phrase you retype for the fourth time this week, that is work that your salary has to stretch to cover, and the schedule never accounted for any of this extra stuff. This video is about to change that. I'm going to walk you through what to build inside your EHR so that your documentation moves into the visit and stays out of your evenings. I'm Candace, a board-certified family nurse practitioner, and I'm a primary care workflow strategist. I work full-time in an FQHC in New York City. I precept NP residents and NP students. I use Epic every single day. As a workflow strategist, my mission is to help primary care nurse practitioners finish their clinical and administrative work inside the hours that they're actually scheduled to work. Not after dinner, not on the weekends, but during your actual business hours. Everything I teach is something I still do in practice. And one of the highest leverage things that I've ever done was spending 2 focused weeks customizing my EHR before my panel was full. That investment has paid me back in hours every single week for several years. Before I get into it, if you want the foundation piece of the system, I already built it for you, and I have a free SOAP note template and user guide linked in the description. It's there whenever you're ready. Section 1, the out-of-the-box problem. Here's what most nurse practitioners don't realize. The default EHR setup is not neutral. It was configured for the institution that purchased it, not for your workflow, not for your schedule that's filled with 20, 24, 27 patients in a day. EHRs have hard parameters that can't be changed, but inside every major system, there is significant room to customize how the data is presented and build documentation tools that reflect your clinical voice. Most nurse practitioners were never shown how to do that. That is a training gap, not a technology problem. Without that customization, you are rebuilding the same documentation structures on every single patient, every HPI, every review of systems, every patient education block, the same cognitive work over and over again, and no system that carries it forward. Most primary care NPs spend 1 to 2 hours per day on tasks that their EHR could be doing for them. That's 5 to 10 hours of work per week. Think about what that means for your salary. A $130,000 annual salary divided across 40 hours scheduled a week works out to about $62.50 per hour. That's what the offer letter implied. Now add 10 hours per week of work that spills outside of your official schedule because the setup was never built to contain that work. Now you're working 50 hours to earn that same $130,000. And when you do the math, your real rate, what you're actually earning per hour, drops down to $50. And that is what I mean when I say your effective hourly rate. Your EHR was not configured for you when you arrived, but you can configure it, and that's what this video is about. Section 2, building your asset library. Every major EHR has tools that help you to build a personal documentation library, pre-built text blocks, note structures, order collections that you can deploy in seconds instead of reconstructing them from scratch. When that library is built, a few keystrokes pulls a complete documentation block into your note, and then you confirm that it's accurate, adjust what needs adjusting, and you move on. The difference in documentation time is significant, but the deeper benefit is cognitive. When you're not constructing your note from scratch on every single patient, you have more bandwidth for the clinical reasoning that actually requires your license. So when do you build it? Well, the best time to do it is before your panel is full. Onboarding is the highest leverage window that you'll ever have for this work because you can actually build this asset library deliberately. Under a full 20-patient schedule, whatever does get built is built reactively and under pressure. And that build that's deliberate and planned is always going to be better. I have a link in the description to a blog post called The Lie of the Default EHR. It goes in deep on how that out-of-the-box setup guarantees that the work will follow you home. It's worth reading after this video. The free SOAP note template and user guide is linked in the description. It's the starting point, a foundational template that you can install and build from, and it's in the video description. Section 3, One-click ordering with order set. Order sets are pre-built collections of labs, imaging, referrals, and treatments organized by condition or visit type. Annual physical, diabetes follow-up, hypertension management, each one is a single click. This single click matters because it eliminates the cognitive work of remembering what to order and the time of ordering each thing separately. Order sets also reduce missed orders. When the set is built correctly, the checklist runs automatically. You are not relying on your memory at 4:45 in the afternoon with 3 patients still waiting to be seen. This matters for your most complex chronic disease patients. The patients who need the most from you are the ones who are most likely to have something missed when you're running behind. A well-built order set is a quality safeguard, not just a time saver. I have a blog post linked in the description on order sets specifically. It covers how to think about building them for your most common visit types. Section 4, protect what you build. The documentation library you build inside your EHR lives on your employer's server. If you change jobs, access disappears. If your employer switches systems, access disappears. The solution is simple. Keep a copy outside of the EHR. Every dot phrase block you build, saved somewhere that you own and control, a cloud document, a personal drive folder. The difference between building a system and creating a career asset. When you start a new job, you're not starting from scratch. You're importing a library that you already built. Here's the through line for everything I just covered. The work that follows you home is not necessarily a patient volume problem. In many instances, it's a setup problem. When your EHR is configured for your workflow, documentation stops competing with your patients for your attention. The repetitive work routes back to the system. Your cognitive bandwidth goes into your clinical reasoning. Your employer gets their 40 hours every week, so make sure that you get yours. The free SOAP note template and user guide is linked below. It's the starting point for the system that I discussed in this video. If you want the complete workflow, documentation, inbox management, delegation, visit pacing, that's what ChartSmart Mastery delivers, and it's linked in the description.